if somebody goes how long without properly treating their diabetes, will you start to see negative hearing effects?
Who knows?
Okay.
It really, it depends.
Sure.
It really just depends on the patient.
Yeah.
How well they're managing their diabetes.
Mm-hmm.
Do they have other factors? Do they have cardiovascular disorder? Do they have anything else going on?
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Back again with a brand new episode of the fastest growing podcast in the world. Whether that's true or not, I have no idea, but we're going to go with it. This is the Ask an Audiologist podcast. I am your host, Kevin Ziener.
And I'm the other host, Dr. Michael Squires.
And today we will be discussing a potential causality with hearing loss and diabetes. Diabetes if you're nasty. The article comes to us via Dr. Madeline Henry of Link Audiology in Silverdale, Washington. So, Dr. Michael, as we get ready for spring, talk to us a little bit about the link between diabetes and hearing loss.
So we've touched on this in other episodes in the past,
okay,
right? But that feels like it was like 6 years ago.
It might as well be.
So diabetes, or really anything that affects the capillary blood flow of the inner ear, can cause hearing loss, right?
Sure.
In fact, we find a higher prevalence of hearing loss in populations with diabetes. We find also research indicates higher prevalence of cardiovascular issues and those sorts of things with patients with diabetes as well.
Got it.
And so what it really boils down to is, I'm going to give you a fish analogy.
Okay.
Ready?
I love a good Dr. Michael analogy.
Listen, one thing I was telling Carly on the way over here is I got to work in more fish analogies because Kevin loves them.
I live for them. It is the thing that I go to bed hoping I'm going to hear the next day.
Yeah. So just like if you were to have a goldfish in a bowl, and then you decide to change the salinity of that water. Let's change the water today. We're going to clean that bowl and fill it with salt water. That fish isn't going to do so well. No. Right? That fish isn't going to last very long.
Freshwater fish is not going to like that salt.
Exactly. So the inner ear is very similar to that. We have hair cells, what we refer to as hair cells. They are essentially sensory cells that are responsible for interpreting sound and then sending an electrical signal up to the brain.
Got it.
The organ that manages the composition of that fluid that bathes those cells is called the stria vascularis.
Stria vascularis. That's STRIA space vascularis.
Yeah, I thought you were going to spell the whole thing. It's going to turn into a 12-minute podcast.
Yeah, right?
No, so the stria vascularis, as the name suggests, is highly dependent on vascularity or capillary blood flow. And so if we've got high levels of sugar in the blood, if we got the sugar,
we got the sugars
in the blood,
then
that stria vascularis is not doing its job. It cannot manage.
Would you say it's like throwing sugar in a gas tank?
Well, here it's like throwing sugar into a fishbowl because the fish,
love it,
another fish reference, cannot survive.
Got it.
It can't.
Okay.
And neither can the hair cells. So essentially what happens is we see a higher level of vestibular disorders because it's kind of the same situation, but we see a higher prevalence of hearing loss as well. So I monitor my patients with diabetes very, very regularly.
So when I mean, these are probably two separate things, right? Somebody has a health concern, which they go to their probably general provider to be able to say like, doc, I think there's something going on. And the doctor's going to run a battery test on them and say, Joe, you got the beaties.
You got it.
You've got diabetes. Where then does, either from the doctor or from the individual, how quickly should they come see an audiologist?
Yeah, and I mean, so, diabetes is one of those things that's going to be a long-term effect. This is not like, oh, I was just diagnosed with diabetes and now I have a sudden hearing loss.
Right.
Like
that was going to be my next question is how fast does it start affecting?
Yeah, it generally doesn't affect it that fast. And in fact, I have patients who have had diabetes for years who it hasn't affected their hearing loss, right? Or hearing.
Sure.
However, that doesn't mean that they shouldn't have it checked. They did right by making sure that they were getting a baseline and monitoring that. So it can be kind of a slow thing. It just depends,
And I was going to say,
like anything else, it depends how out of control their blood sugar is, and how well they manage it.
Exactly. I was going to say, if you're diagnosed with diabetes and you're up on your medication and you're taking care of it, I imagine that's just as important as getting a baseline hearing exam.
And I mean, hyperglycemia, diabetes, we kind of have the varying levels.
Yeah.
And so patients come into me and I'll say, are you diabetic? And they say, yes. And I say, okay, how do you manage your diabetes?
Sure.
And then you kind of get the snicker from the families and they're like, he doesn't. And I'm like, okay, now I know that the prevalence in my head has gone up.
Got it.
Of things that we need to look for. So, one thing that I like to test with diabetic patients is if we're going to do a standard hearing battery, right? Audiological evaluation, as we call it, we're going to monitor your hearing sensitivity. Let's say that comes back normal. Then I'm going to go over and I'm going to do another test called otoacoustic emissions.
Okay.
So what we're doing is we're putting a couple sounds into the ear and we're waiting for the cells that are responsible for hearing to give us a little echo back. It says, I'm okay, right?
We're good.
We're good.
Yeah.
All good.
We're fine. Thanks for coming. See you next year.
Yeah. Or the other thing you hear is, exactly.
Yeah.
I thought you would have like a cricket.
No, I mean, wait, hold on. I actually don't know that I do. Actually, do it again. I don't know what I have programmed here, but.
Okay. The other thing you're going to hear is.
Happy birthday.
Probably not. Probably not happy birthday. I was looking for crickets, but those hair cells.
That was better than crickets. Sorry.
Those hair cells are not going to they're not going to respond, and so you can use that almost as a precursor, right?
Sure.
As like okay, well, we're already seeing some degradation of the signal from those outer hair cells, and so we really need to stay up on the monitoring here. So it's not affecting you from a one-on-one communication.
Sure.
On my side, if you don't hear anything or you don't see a result, then we're going to have to buckle down and say, hey, look, this is the plan of care. This is how we're going to do our follow-up.
Got it.
We need to check this fairly regularly because you're not realizing this issue right now. But it's a coming.
Got it.
It's a coming.
And then, again, I feel like I say this every single episode. Ideally, everybody's individual. This is what it is. If somebody goes how long without properly treating their diabetes, will you start to see negative hearing effects? Yeah.
Doesn't it? Who knows?
Okay.
It really, it depends.
Sure.
It really just depends on the patient.
Yeah.
How well they're managing their diabetes. Do they have other factors? Do they have cardiovascular disorder? Do they have anything else going on that's going to contribute to this?
Got it.
Take that prevalence kind of higher.
Yeah.
Generally what I like to do is monitor it annually. I like to look at it every year, then I can pull them up. Because generally what happens is if you wait longer than that, you're going to go like, there's been some change, but then we're good. And then now you've spaced this out so long.
Yeah. And you're trusting your brain. It's not like you've ever had a hearing exam. So you're just thinking maybe that last noise I heard, maybe I didn't hear it as well, or maybe I heard it clear. I don't know.
Yeah, we can actually check. We can actually monitor for those really small changes and stay ahead of it. We're not waiting years before we're treating it. We don't want this person to be yet another statistic.
Got it. So put a bow on it. What if you as a patient have diabetes, what should you do to make sure that your diabetes does not affect your hearing loss?
My chair keeps rolling out of frame.
No, you're good. You're totally fine.
So this is what I would say. Talk to your primary care physician. Let them know, hey, I watched this amazing podcast episode. So I do have a little bit of concern about getting my hearing checked. I just would like to get a baseline.
Okay.
Right. So I've been diagnosed with diabetes or hyperglycemia or, whatever the progression is at that point.
Yeah.
Can you send me a referral so I can get my hearing checked and get a baseline?
Got it.
And that's the beginning. So then you find your audiologist and you say, hey, I've got diabetes. I'm doing my best to manage it, which I hope is the case. I've stopped drinking Mountain Dew.
Yep.
And eating candy corn.
Yep. Even though it's, March.
Yeah. So some people
what are you still doing eating candy corn in April?
Yeah, the kids didn't want it.
That's true.
But we want to start getting really good, solid information annually so that we can really track to make sure that nothing's changing. And more so than anything, when a hearing loss develops or if it's present, treat it.
Got it.
Treat the hearing loss.
And as a reminder, just always eat your fruits and vegetables. Come on.
Especially on
Your
birthday.
And always visit Ask an Audiologist for your hearing health care needs. A beautiful job as always, Dr. Michael.
Hey, Kevin, without you, I'd be nothing.
And always remember this, guys.
Happy birthday.
We'll see y'all next week.
You can find more information at askanaudiologist.com. And you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
You think it makes it worse?
It potentially can. I mean, there are horror stories that I have heard of people doing this and then the wax on the candle melting down into the ear canal. And it's extremely traumatic.